All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. I hope that everybody is staying safe and healthy. My apologies, I could not come in yesterday. And advance apology for tomorrow. I have my second shot for Moderna tomorrow. So let's very quickly do a roundup of some news. So number one, today we'll have Dr. Pierre Corey at 6 o'clock in the evening. So I'm pretty excited about it. We're not going to talk about the mechanism of actions and drugs. I think mostly Dr. Pierre Corey is interested in discussing why drugs like ivermectin are not being allowed or approved or given some more exposure. And the second thing, tomorrow is my Moderna second dose in the morning at 9:20. So hopefully after the dose, I would do a quick live from there. And hopefully I would not have too many symptoms. It seems like the second dose would have symptoms. And I believe we all cool beans know the reason for that. And the reason is that with the first dose, the immune system has become primed. And the second dose is going to come in and kind of irritate the immune system. And immune system would say, well, I know you, the spike proteins. And so within 24 to 48 hours, it would start reacting. And that reaction could cause side effects as well. So we'll see what happens. I'll continue to update you. 10th of this month, we will have Dr. Antinatos with us. I believe that Dr. Jalali's talk yesterday was a groundbreaking talk. I think it is worth listening to. I think it is one of the gems in the whole talks that we have been doing here. Similarly, I think what needs to be done is to look at Dr. Jalali's talk with bradykinin storm that I had talked about in about 8 or 9 months ago with cytokine storm. If these three things are put together, that kind of tells us a whole scale of the pathologies, and then appropriate therapies can be used. And then finally, India mutant news. What I do not know is how much of this is rumor and how much of this is truth. I tend to be suspicious of the WhatsApp messages that are circulating. I think that you know that WhatsApp messages are the ones that get me started to do these talks, and that message was wrong and it actually was damaging. So here, there is a message. So I live in Bay Area. I live in Silicon Valley. And of course, there are lots of folks from Asia over here. So this, I have no idea of confirming. The basic message here, it's in my hand, is that the India mutant has reached Silicon Valley because there is more traffic back and forth from here to India. So but the thing that seemed to be fear-mongering, and I'm wrong, I may be wrong here, I have to confirm it, is that the person continues to say that, hey, youngsters are going to hospital and youngsters are getting sick here in the Bay Area. I haven't yet heard that. What they keep saying, the people under 30 are going back to hospitals and kids are going to hospital. So I need to do some more research, but generally idea is that there is something. Second news that had been circulating yesterday, and I tried to find some more about this and could not, and that was the Department of Medicine. So Dr. Rajendra Kapila from Rutgers University, I believe, New York. He is the infectious disease expert. He was the infectious disease expert. Rest in peace for him. He's set to receive the second dose of a vaccine, I believe Pfizer vaccine. Then he flew to India. Due to his father-in-law's poor health, he got infected with COVID. I'm now reading it, and died yesterday in India. So the folks tried to say that the Pfizer second shot or the vaccine does not work, or vaccine does not work against the mutant. And I have no way of confirming. We have a cool bean, Siddhartha. He said that he would help me figure out some more information. The question is, how far after the second dose was he fully protected? And then, of course, as you can see, there is one more quick news, which is, I think maybe it's a lot of private information about me, but I think for the sake of this service. So my mother-in-law developed, she said to me yesterday that I went for my second dose. So she has been taking, I believe, Sinopharm's vaccine. She took Sinopharm. She went in for the second dose about 6 days ago. And she said, when I came back, I have since been, so she called it vaccine's side effect, that she said, I have a runny nose, congested sore throat, I develop fever, I take anti-inflammatory, and I become okay. And she said 2 days ago, I have lost my sense of smell and taste. And so, of course, I was shocked because I have been keeping up very much with all of my family members and making sure that they are protected. So she was taking zinc, not quercetin, but vitamin D and some other supplements that I have said. In addition to that, she was taking, so I had asked for a full dose of ivermectin on a weekly basis, but I was told, so I became surprised and I said, how did you catch this? Were you taking the things that I had requested? And she said I was taking 6 milligram of ivermectin weekly. So 6 milligram, I think she's 70 or so kilogram. So 6 milligram was not the right dose. And this is what is very common. I'm seeing that patients modulate the dose thinking, oh man, I have to take 4 pills or 2 pills. And why should I take 2 pills and I'll take less? And so compliance is a problem. The other thing that was interesting was that she felt it was the dose, but the rest of the family member, some more relatives in the same household, she was visiting someone, they also became sick. And here is again lots of information about my family, but interesting thing is this: almost all of my family members have been taking these supplements, and some are taking ivermectin, some are not. So the other family members, there were 2 more women. Fortunately, the other people had been visiting other places, so this was just 3 folks at home. Obese, and my mother-in-law is not. So both of them also developed these symptoms. And they were not taking ivermectin, although I had asked for, but I cannot push everyone. So I had asked for the ivermectin, but they were all taking zinc and not quercetin because it was somehow not available. And they've been taking vitamin D and so on, the other supplements. So I was, of course, quite nervous about these folks because I thought that obesity is a very grave situation. And then this relative of mine, her husband actually passed away a couple of weeks ago, an uncle of mine, from COVID. And I discussed that, I think a couple of weeks or about 3 weeks ago. And I discussed it that he did not believe that there is a virus and he would just go out without mask and he would just expose himself to all kinds of possibilities. Unfortunately, he got it in, and even when he got it, he said this is not COVID, and refused to go to a hospital, became severely ill at home to the point where he could not breathe. And then the oxygen levels started dropping. They brought him to the ICU. He was tested positive, and then he did not survive. So her husband passed away, and I was actually very nervous for her as well. But here is the interesting thing. They were all taking supplements. Now they all say that we are about 6 days into it. This person is younger, and she said that I have actually almost recovered. I only have some remnant cough. This person is her mother. So she is also almost recovered, but she has chest congestion and cough. And I am, of course, concerned about the chest congestion because that can take a turn at any time. Here, my mother-in-law, she was talking with me yesterday, today, I'm continuously being in touch, and she seemed to be fine. She's talking fine. Her oxygen levels are fine. And she thought this was a side effect. So if I look at that, she caught it at the vaccination center. And then she brought it back, and then the rest of the family became ill as well. She still has it. This person still has it, but the younger one got it and recovered 2 days ago. So I'll keep you up to date. Um, it is interesting for me that ivermectin was not being taken, even after I had been stressing that please take it. So then I asked them to get the medicines, which included ivermectin, fluvoxamine, and some more medicines. And fluvoxamine was not available. The drugstore said tomorrow, and the ivermectin was available. So if they don't have fluvoxamine, then I'll think of what alternative I can do. So this is the quick news. The other part that I wanted to quickly go over is this. So the total 1.17 billion shots have been given. And we'll talk about India in a second. So if you see here, Seychelles is the top. Then Israel is now 10.5 million doses, 57.8% population covered. So if I go down here, you would see, interestingly, not much data from China. US 44.4% covered with one dose, 31.8% covered with the second dose. India 9.4% covered with one dose, 2.1% covered with the second dose. And I keep hearing this, and I keep trying to correct it. Many folks from India, my friends, they reach out and they say the vaccines have failed. Vaccines are not working. It's not about the vaccine at all. It is just a lower number of vaccination, lower percentage of vaccination. And then on top of that, I've discussed many times that there are many other reasons, including the variants as well. And so that is India. We'll talk a little more later today. EU 24.9% one dose and 9.1% two doses. Again, not sufficient. UK 51.8% two doses, one dose, and 23.2% two doses. So UK actually did an interesting thing. Brazil is not in a good condition. I think there are so many SOS calls from Brazil that it just hurts me to see those. Germany 8% to 28.3%. So Germany is kind of reaching. This would continue until they reach 40 or 50%. France 24.9% and 10.3%. Turkey is 16.9% and 1.4%. And as you can see here, UAE is not reporting. I do not know why. Israel is here, 59.7 and 55.9. Canada is 29.7 and 2.6. 2.6, which is low as well. Let's look at Israel. Don't you love it? Look, no cases. So I'm sure that even if they have some cases, there is not much interest to report them anymore, or maybe they actually do not have any cases. And so if you look at this number, 74 is the 7-day moving average. If I bring it to 3 days moving average, 47. So beautifully controlled. And I am still curious. So total cases 1,259. Remember, they had said a few weeks ago that they feel that Indian variant has arrived in Israel. So if that variant was kind of breaking through the vaccine, then Israel would probably, and if the variant has been there, then Israel would probably be the first one to say, hey, Pfizer vaccine is not protecting. So when I heard the news about the doctor from New York yesterday, my first thought went to Israel, that they had also reported that we saw cases of Indian variant, or 617, if I should say it, and 3 deaths. 3-day moving average, 1 death. So I'm pretty proud of the way Israel has done. I still kind of admire that they struck a deal with Pfizer in time and said, we'll give you data, you give us vaccines, and then they prioritized the vaccines. Pakistan, so as I just talked about it, that Pakistan has this wave as well, and I talked about my relatives too. So here, this is the wave, although it seems like it is reducing. Now, is it reducing because they're not reporting anymore, or Is it reducing because people are changing their behavior? To me, it seems like there may be both and more, because when I look at WhatsApp and various groups, I see that many folks are just telling each other that, hey, wear masks and stay at home and so on. Active cases are declining slowly, and number of deaths are coming down as well. So that is Pakistan. India. So India crossed this grim milestone today, 20 million cases. So the only country now that has more cases than India is the US, unfortunately, both unfortunate. 20 million cases. And then if you see here, to me, it once again, so maybe it is just me being optimistic, but to me, it once again seems like the wave is going downwards. Although we saw this kind of a behavior here as well, and I kind of thought that, all right, they're going to go down now. And then there was this peak. So to me, it seems like the wave is going downwards. There were reports that in New Delhi, I believe, there were lesser number of cases and lesser deaths as well. So if that is the case, it is good. I see raging wars as well on Twitter, where people have been talking with each other, and somebody is saying that, hey, ivermectin doesn't work, and if it was working, it would have worked in Uttar Pradesh, and Uttar Pradesh's cases are not good. And then others are saying, well, it is ivermectin working, but the people are coming in. So there is a lot of back and forth going on. I think it's not a necessary back and forth. If somebody is not going to believe, they're not going to believe. So you can't bring whatever you want. On the other hand, if somebody is going to believe it, they're going to believe it. So that's just how it is. So I feel it's not needed to have those fights. Now, 3.4 million cases. And then number of deaths are now hopefully reducing as well. So India definitely in a state of crisis, but let's see what happens further. It looks like it is going downwards. United Kingdom, UK, 4.4. So another country which really impressed me with the way they approached this. Remember, they're the one who got criticized for increasing the distance between the two doses. And they said, let's just go out with mass vaccination with one dose. And here is the result. So good result. They have now become sustained at this kind of tail end, but still much better. They have opened up the society, or opening up the society as well. So that is a good news. And some folks, some friends were all nervous about the 617, the variant from India, saying that, hey, this is now a new pandemic. We are all now doomed. We're going to just get stuck. I still do not believe that. I still do not believe that we have a new pandemic. If that was the case, there have been a lot of traffic back and forth from India. It would have been spreading and killing further those who were already infected or vaccinated. And there is, of course, there is one news that I discussed, but it does not seem to me to be that way. And then there would have been people, scientists, who would have come out and said, you know what, this is actually SARS-CoV-2 now. So we are still at a variant stage. I think it's just that we tend to gravitate towards more scary part of the news. So the UK's, look at this. Number of deaths have gone down as well. 8 3-day moving average. So very impressive. France, I just had it for a quick comparison. So France has still a kind of a broader wave still going on. Active cases are declining, and the death rates are kind of following that. It's just a very long second wave. Sri Lanka has started another lockdown, because if you see here, there is another wave that they are developing. So is this the new variants that are there, or is it just people getting tired? Active cases have gone up as well. So Sri Lanka is actually locking down again. In India, there are lots of calls to say, let's place another lockdown. I think government has not yet agreed on that. Sri Lanka is doing another lockdown as well. So then this is Cambodia. And Cambodia is also as you can see here, is in their first wave, and that first wave is actually increasing. Active cases are increasing, and the death rate is, of course, following that as well. I wanted to quickly see this before we move on to our questions and discussions. Let's see how, for example, this is Maharashtra. So if you see here, active cases are actually become almost constant and towards decline. So that is a good news. Similarly, if I see Uttar Pradesh, and if you see here, they are also going downwards now for the active cases. So it looks like there would be a reduction. This was a similar news for the LA here as well, Los Angeles, which is about 6 hours from where I am, that they were also reporting less number of infections and no deaths. So it seems like we are kind of moving in the right direction. Okay, so thank you very much for listening to my quick news roundup. And let's see if there are any questions that we can talk about. James Newton says, how long have you lived in the Bay Area? I came here, I believe, 2013. Before that, I was in Massachusetts. Annabelle says, what is an active case, positively tested or sick? I have no idea. So this would be dependent upon the reporting people. I would consider active case to be positively tested. But there are going to be so many. And they were saying for India, for example, they were saying that there are so many people dying, but they're not reported and they're not shown, they're not counted. James Nguyen says Modi doesn't want lockdown, he wants more pandemic. I don't know that if somebody would want more pandemic. Not wanting lockdown could be a different reason. It could be financial reason, economic reasons, maybe the elections. But wanting more pandemic is just beyond me that somebody would want that. Colin Hamel says, was there also a typhoid outbreak in India at the same time? So Colin, this is what I've discussed before as well. It is interesting that in India, Pakistan, both have seen this, that where there is an outbreak, over there the typhoid or gastritis occurs a lot, and the typhoid tests come back positive. And so there is a typhoid outbreak as well. Now, is that truly a typhoid outbreak, or is that a gastritis because of COVID and the typhoid tests are cross-reacting? That is what I do not know. But this has been reported many, many times. Simple Garden says, crisis management in India right now, heartbreaking. Of course, you're correct. Muhammad Khalid says, in India, doctors are giving ivermectin dosage to patients 10 to 12 milligram for 4 to 5 days. So I think it should be counted with the patient's weight, and I believe that FLCCC says that up the dose. So 10 to 12 milligrams seems to be 0.15 to 0.15 to 0.2 milligram per kilogram. That seems at this time in India to be the lower dose. The dosage, so for my family members who reported yesterday, although it seems like they're on the tail end of the recovery, but has still started them at 0.4 milligram per kilogram. GB says, question, Singapore is using Pfizer vaccine. Huge number of doctors in a hospital get infected in cluster by alleged Indian double mutant. So the question is that a rumor or is that a truth? Because interestingly, humans have this strange tendency that they invent bad news and they like to tend to gravitate towards bad news as well. So I do not know what is the truth there until I can read it. But Singapore generally seems to be doing very well. Look at their, so death, for example, 1 death on May 1st, 1 death here. Number of cases in Singapore are, if I take three days moving average, so 30 per day. almost like Israel or even lesser. So Israel was 47 or 41 per day, here 31. So generally they're doing okay, but I have to read up on this cluster of doctors getting sick before I can talk about it, GB. So James says, is 117 in Michigan, USA? So 117, I believe we're talking about the UK or Kent variant. That has been almost everywhere now. So I would think that it is in there as well. John Ray says, be smart, be safe, stay alive. IMAS plus, yes. Westfield says, a total lockdown for few weeks in India will reduce spread. In parallel, you simply have to vaccinate, but these max vax centers are super spreader events, need to vaccine every local pharmacy. Absolutely. Just like I talked about my mother-in-law, that she went in for the second dose of vaccine and she came back with COVID. Very interesting. So James says, Dr. Bean, do you know the world is actually running out of zinc? I did not know that. Heather says 44 likes and 264 people. So right now, 355 people live. So like, thank you. Liza says the problem with Indian variants 617 I had read is that they have 11 plus mutations and 1% of virus collected sequence done. Indians are fighting for their lives. There is no time for data right now. Yeah, so mutations is a constant. It would just continue to happen. The 617 had 13 mutations and 2 were the ones that were more scary. And because of that, they're called double mutant. They're actually 13. GB says, I was amazed by Dr. Freed's presentation. I would like to share my case. 6 days after AstraZeneca thrombocytopenia and was on DOACs. But after starting SRI for anxiety, was having purpura ecmosis. Interesting. So we should separately discuss this. I hope that you're doing fine now because these signs are not. So Arsha says, when to start ivermectin prophylaxis if traveling? So I would say that day 1, day 3, and a couple of days after. So maybe about a week before and start with 2 doses at least. And then Anubhav says, did your mother-in-law have milder disease due to first dose? Possible. So she was just running around. She had me on WhatsApp video call, and she was just doing her things and talking with me. So she didn't even seem to have the disease, and I was getting all scared. Her complaint was, hey, I cannot, for 2 days, I cannot smell or taste, which is usually an indicator for severe case, but she was actually said, I had it for 5-6 days and now I'm much better. So the whole household seems to be on the right side, but I started them on the medicines anyways. Fran Crook, could remnant virus particles may cause long COVID, also create vaccine side effects? There has been post-vaccine infection spike on country graphs overlaying vax timing with infection increase. So first part of your question, could remnant virus particles may cause long COVID? For long COVID, the important thing is for those, so short answer is yes. The more elaborate answer is that these have to be cleared out, those remnant viruses or zombie viruses or particles with spike proteins on them. And they, till they're not clear, it is possible that they would continue to cause immune systems triggering, which would then cause cytokine storm, which would then cause these inflammatory signs and symptoms. But it should go away at some point, ideally, in theory. And from most of the experience I'm seeing with the long COVID patients, it does go away. And you may have heard my long COVID discussion, although there are some things that still need to be corrected, but it would be interesting to see that as well, where I've discussed it. Now, the second part, post-vaccine infection spike. I don't think that that is the correct case. And if you want to see this, that is there a post-vaccine infection spike, then look at UK or look at Israel. They have done significant vaccination. Other spikes are just spikes because of maybe variants, not because of vaccine. A country, for example, let's say India, 2% fully vaccinated and 9% one dose, if they have this spike, we cannot say that this is vaccine related spike. This is a variant. If you want to see vaccine related outcome, Israel and UK, I think, should be the first one. Look at US as well. US is almost 47% one dose. Was that correct? Let me just quickly make sure I'm not saying incorrectly. So US, Bloomberg, if I go see here, US is 44.4% and then 31.48%. So this, we should see what happens. And if you look at US, there is no post-vaccine spike. US has actually come down. So this is, Fran, this seems to be sort of a rumor that has been started. It started from Geertz talk, and then people started connecting these dots that, hey, variants only occurred where the vaccines were happening. No, variants were occurring before. And if you still want to see it, go to next strain or outbreak.org, nextstrain.org, go to SARS-CoV-2. I have shown this one many times. Here, these are all the variants that they have been seeing. And these have been seen from the very beginning. So it's not a new thing. These are all variants. Every dot here is a variant. And you can then filter it out. And they say it, I always read it for the audience here. They say it over here that, hey, we cannot show more than 3,000 dots because of the performance reason. But there are hundreds and thousands of more. So there are so many variants. And you can actually trace an individual variant. You can see how it is traveling in the world and so on. So the reason, Fran, I provided this more elaborate answer is to reduce this anxiety that somehow vaccines are related to this. I don't think that is the case. Chandrika says, when I get COVID-19 vaccine and get fever as a side effect, will my pregnant daughter be affected by my fever? No, not at all. And this is another strange rumor that has started. And Chandrika, I'm not talking about you. Many people have asked me this, that somehow vaccinated people are shedding things that would make unvaccinated have issues. And people were asking, how do I protect myself from vaccinated folks? And that just makes me so upset that there are people who are creating such rumors which would only add to the division in the society. This is already difficult enough to be able to say, for vaccinated folks to say, we are okay with those who didn't take a vaccine, and for the non-vaccinated to say, we are okay with the ones who are taking a vaccine. The ones who are not taking a vaccine are calling these folks sheeples, and you're going to die, and you're going to do this, and you are part of that big experiment. Those who are taking vaccine are looking here and saying that you don't understand what's going on. On top of this, now there are rumors like this, that there are vaccinated people are shedding things. No, they're not shedding things. Liza says, Dr. Mubin, the serotonin and serotonin pool stored within platelets granules, could you explain mechanism? Serotonin was not explained like Dr. Jalali explained last night. Yes, so I would have to do a separate discussion. So I'm going to take Dr. Jalali's paper and I'm going to talk about it. This morning, Dr. Paul Marek reached out as well to Dr. Jalali and I, and he said, I loved your talk. And then he said, here is my paper that I'm working on, and can you guys review it and then maybe draw some cartoons and diagrams, which seemed to me asking me that, hey, Bean, can you draw some cartoons here? So it was a good talk. Andrea Norad says, I developed COVID arm after the first dose of Pfizer. Would switching arms to second dose reduce efficacy since it is using different lymph nodes? No, not at all. What happens is, just very quickly to kind of help with this. So what happens is that, so let's say this is our body. So now what happens is this person is looking down for some reason. Uh, and let's say we have lymph nodes. The posture is really weird, so don't mind. The lymph nodes are present in various parts. When a vaccine is given, let's say here, and the vaccine then causes the local dendritic cells and the macrophages to work, these macrophages would then travel up to the local lymph nodes and ask them that, hey, look, guys, I got some antigen that would cause inside the lymph nodes, that would cause various B cells and T cells to start proliferating. And when they would proliferate, they would not just sit in here, they would actually come out as well and circulate in the body and go and live in the other parts of the body as well. Because body knows, body is a unit, it doesn't have boundaries in it. So body knows to kind of spread out the controlling or defending mechanism everywhere. So these cells would then go and become resident in other lymph nodes and so on as well. If there are some bigger chunks of body that are kind of separate in terms of density and presence of type of cells, would be, for example, GIT has its own mechanism compared to the rest of the system having its own mechanism, compared to brain, which has its own kind of a sheltered mechanism, compared to other immune privileged sites. So there are some sites that are different, but to your question, no, you'll be, if you wanted to switch your arm, that would not cause any issues. GB says, we are underestimating another strain, 618 in West Bengal, India. It is having 2 deletions in amino acids, 484, 417K immune evaders mutations. So if we say strain, then you are saying that, hey, this should be SARS-CoV-3. I do not know if it is SARS-CoV-3. It is still seems to be a variant, but we'll do more talk. So thank you, GB, for bringing it up. Corinne Hemsley says, had second AstraZeneca Sunday, first shot gave me a breast lump, not in the lymph gland, same side as vaccine. And shot has done the same, second shot. So there are lymph nodes in the breast area as well. So it really just depends upon the drainage, that where is the drainage occurring in that area, where is the proliferation occurring. Jeffrey Winston says, besides Luvox, how many psychotropics fight COVID? Don't know. So we know about fluvoxamine because of a tiny study. And then after that, folks like Dr. Fareed Jalali or others who have been connecting the dots with the serotonin. We do not know other psychotropics. India Nord says, thank you very much. And thank you very much for the super chat. Mac Burake says, if fully vaccinated, Moderna and traveling internationally, should I carry ivermectin to further assist in case of infection? So I'll give you my example, and I'll give you the example of Dr. Paul Marik. When Dr. Paul Marik had received his vaccines, he said that, hey, I was going to travel and I took ivermectin anyways. Similarly, when I look at the things around me, I take ivermectin as well. So I can give you these examples. Neri says, please look in NIH for informed consent disclosure to vaccine trial subjects of risk of COVID-19. Would love to hear your thoughts. Okay, so I think I'll need to be reminded, maybe not tomorrow, but day after. If you can remind me, Neri, then I would look it up and discuss. Math Cubes says, if I had an immediate allergic reaction to the Moderna vaccine, such as an somewhat swollen airway, should I go get another brand such as Pfizer for my second dose, or should I not get a second dose? So this is something that to talk with your doctors, because ideally they say, so this is an allergic reaction, especially the airway swelling means allergic reaction, which could become significant. And they say that people who have severe allergies, I would put this kind of a situation in severe allergies. They shouldn't take a vaccine. Now, you have taken one. How severe was it? I do not know. But you should talk with them before you take your second dose. Maybe they would have some ideas. Switching the kind of vaccine, for example, if you said Moderna versus Pfizer, both of them have lipid nanoparticles. That means they both have polyethylene glycol. That means they both could cause a similar allergic reaction. But this is something that the provider should research, your doctor should research and talk about. So Nancy Park says, are you still going to recommend taking melatonin based on last night's show? So what I understood from the last night's show was that melatonin still has a relationship. So what is exactly that? I need to actually go over that. So for example, my family members, I asked them to take melatonin as well. So Ali G says, should someone stop taking aspirin tab 75 milligram before or on the day of the second AstraZeneca dose? So this is an interesting question. Somebody had left me a question as well on LinkedIn. The folks leave me questions at so many places that I sometimes just happen to see them. So I was just scrolling through LinkedIn and I saw these messages. And this person, he was anxious that I had taken baby aspirin, so 75 or such, a day before the vaccine. And CDC says don't take it and it could reduce the efficacy. So have I destroyed the efficacy? And my opinion is that the drugs like aspirin are temporary. If you think about usage, for example, let's say we become infected. So here we are, and I think I can draw a stick figure better. So here we are. So whoever wanna pick this one. So I made ears too. So here we are, and let's say that let's take one example. Let's say we are infected. And if in that infection we develop symptoms, fever and those things, and we take aspirin, do you think that taking one tiny baby aspirin actually just helps? You know that it only works for a few hours, and then you start taking more aspirin and then it works for a few hours. So because aspirin itself is not an antibiotic, it is an anti-inflammatory. I totally agree. It is very, very potent, not as much potent as others, but it is very potent in platelet inhibition as well. But the problem is aspirin does not stop production of new platelets, and platelets are being produced all the time. And that is why you have to continue to take aspirin, because the new platelets would come in and say, ta-da, I am here. And now you have to take aspirin for this guy as well. And then another guy would come up and say, hey, I am here. And now you have to take aspirin for that guy as well. So the aspirin would not just take the infections out. And why I'm saying taking the infection out, when somebody thinks that the inflammation or immune system would not be efficacious, then if that is the case, then fevers and those things related to infections would also be not doing. So I should not say taking the infection out. I should say it would suppress the immune system and let the infection just become expanded. And that does not happen with aspirin-like drugs. So baby aspirins, I do not think would cause any issue with the vaccine efficacy, but still from a CDC's point of view, they say don't take it before the vaccine. They say it is fine to take it after the vaccine, which is interesting for me, that if you take it after 4 hours of vaccine, then what did the vaccine do in the meantime? It has done its job. Vaccine is actually going to continue to do its job for days. So it's just inconsistent messaging. William is William, what happened? Tell me. Nancy Dembling says, Dr. Mubin, you will do well with your second Moderna. My second Pfizer resulted in a very sore arm. I switched arms, iced, stretched it, and hydrated sufficiently through day and evening. Also took a homeopathic. Very interesting. Thank you for this. Zero or XOR encryption, XOR encryption, exclusive OR encryption. Dr. Bean, did you get a chance to look into Dr. Geert's theory on vaccine? His interviews are being removed by YouTube. I love to see your interview with him. No, so his mechanisms are wrong. I don't even want to have a comment about that. The mechanisms are so off the charts that it's just not even worth discussing. Humble Bean says, for patients with a history of Guillain-Barré syndrome and or patients with a history of myelin sheath damage by autoimmunity, how risky would vaccine be? Vaccine options. So we have done this discussion many times in two ways. One way is the vaccine trial result. And vaccine trials have included people with autoimmune diseases, and they have not seen any issues with them. So that is one. So that is a data point that, and they actually think that because autoimmune disorder folks are in the risk list, they actually believe that folks with autoimmune diseases should get the vaccines quickly. That is one. The second part is, which I think about, and I may be wrong about it, and that is this: a person with an autoimmune disease have sorry for my voice, this is what happens in the morning to my voice. It needs to break in a little bit. So the autoimmune disease in that person, usually what is happening is that some cells, let's say B cells, they have been producing antibodies, and these antibodies are attacking some tissue. So let's say in this case, let's make a axon or a neuron. So this is a neuron with lots of axons and dendrites, not lots of axons, but one axon and many dendrites. And here is the myelin sheath. And let's say that the person has GBS and the myelin sheath gets damaged. And this is because of, let's say, because of the immune system antibodies are sitting here. And they're taking some sort of a drug to kind of keep it under control. But that still tells us that their immune system cells are creating antibodies and creating more than normal and sort of antibodies that should not be created. So if in such person, when you give a vaccine and vaccine comes in and releases cytokines, cytokines do not have eyes to say that I should only go and activate those B cells that are related to a vaccine. They would try to activate any B cell that is holding on to an antigen. Imagine in our body what happens is that B cells and T cells are standing holding the thieves, the antigens. Imagine a cop who is standing holding the arm of a thief or somebody who's done bad, but he's just standing there. And they now need an order to say, okay, bring them into the jail or into the police station. So similarly, B cells are sitting and they are joined with many other cells that are presenting an antigen. And these B cells are just sitting there. Now, usually if they sit there for long enough and they're not given an order to work, they become anergic. Anergic means they stop minding that antigen and they leave it and they say, you know what, I didn't get an order to kill this antigen, so I think you're okay, go away. But in autoimmune diseases, imagine that B cells are now sitting and they are ready, and you pour some cytokines that are generated by the vaccine. What would happen is whatever B cell is present and is trying to be active, when they get the cytokine, they will become active, they'll produce the antibodies, and that is possible that can cause a flare-up. So my thinking is that if the person is on medicines, they should continue to take those medicines, because in autoimmune diseases, when you're taking medicine, so let's say here is a person with normal immune system and this is their antibody levels. I'm just making up a diagram to illustrate. And here is a person who has some autoimmune disease and this is their antibody level and this is the extra part. So when they take drugs or medicines, they kind of remove this extra part and try to bring the immune system back towards normal. So if now they take a vaccine, it should be fine. So if you're not taking any medicines, talk with the doctor and say, hey, I'm going to go get a vaccine. You may have a flare-up at that time, you may not. So what should I do? Should I, after the vaccine, take maybe, let's say, steroids or some other modulators, or should I take anti-inflammatory? So this is a discussion to have with your provider. But I would simply say this, that is some care and planning to do. Generally, in trials, this has been fine. So let's answer one more question. Satya says, ivermectin will not interfere with mRNA vaccine. Okay, will ivermectin interfere with Covaxin? Very good question. Very good question. So a more elaborate one as well. So let's do this. Let's take a cell and let's take two cells. One is going to be infected and one is going to get Covaxin. So I believe Covaxin is the inactivated virus, correct? So let's say we give this inactivated virus, and here it is kind of dead virus, and here is the actual active virus. So the active virus is going to be connecting with ACE2, correct? And then it is going to try to get into the cell. So that connection to the ACE2 and getting into the cell can be interfered by the ivermectin. Now imagine that this dead cell is also going to somehow automatically connect with the ACE2 as well and enter the cell through the ACE2 pathway. And if ivermectin is present, it is going to prevent this as well, or kind of stall it, reduce it. And so here, infection and vaccine, they both will have a response from ivermectin that there would be slightly less entry into the cell using ACE2 receptors. Now, having said that, a vaccine which is inactivated virus, its job is not to enter a cell through the ACE2. Its job is for this little dead virus to just sit there, just be present there. And then somebody is going to come in, for example, a macrophage. It is going to look at this thing and say, oh, wow, look what I got. And how does it look at that? It has PAMPs and DAMPs. It has tall-like receptors. So there are pattern matching things. And it's going to kind of touch that antigen and say, what the heck is this thing? And then eat it up. And this process of eating up or phagocytosing the pathogen is not interfered with by ivermectin. So here we have an interference. Here, if the dead virus is going to attach to the ACE2, there is an interference, which is actually a good thing. But when the vaccine is being taken up, no interference. Once it has been taken up, now the second step is for the macrophages, neutrophils, dendritic cells to kind of start boiling and killing this thing by pouring acids on it. So we would have a lysosome. Lysosome is, you can say, small stomachs in our cells, which have acids in them. And these cells are going to connect the lysosome to this dead virus particle, phagosome, and they would fuse and we would then digest it and destroy it. Now, ivermectin doesn't do anything with that. Here, this process will be going on as well, but the virus, once it enters, it is an active virus. It is going to start releasing the messenger RNA, which would then go into the ribosome and make the virus particles. Here, there is no going into the messenger RNA because the virus didn't come in through the spike protein. And even if it did come in through the spike protein, the viral RNA is inactivated. It has been damaged. And so even if the RNA is present, it's going to do nothing. So once again, ivermectin is not going to interfere with this. Then if you go back to the infected cells, there is the RDRP produced, 3-chymotrypsin-like protease produced. Those enzymes by the virus will then be stalled by the ivermectin as well. Here, there is no such enzyme produced because we have actually eaten it up. We have put it in a cooker, in a pot, and we are cooking it in there. So there is no RDRP produced. There is no ribosome involved. There is no RNA giving off new particles. So ivermectin would not interfere with this process. Then if you come back here, the active virus may send the cargo in the nucleus to prevent the production of interferon. Here, the virus would not produce any cargo because it is the poor thing. It's a dangerous one, right? It is stuck in a jail and we are kind of chopping it up. So it's not going to make any interferons of those. So ivermectin would not interfere. Over here, the ivermectin interferes with this as well. Ivermectin interferes here as well. Finally, ivermectin can interfere with the nuclear factor K beta. And that is an inflammatory process. And here, when the cytokines will be released, there will be nuclear factor K beta that would, in various cells, would become activated, and ivermectin would kind of interfere with that, which is a good thing. It would reduce inflammation. So if at all, there are two possibilities of ivermectin kind of interfering in some steps, and they both are actually good steps. It is good that ivermectin would interfere with the virus connecting with ACE2. It is good that it would modulate the inflammatory system, but all the other immune training steps are not interfered with for the vaccine by the ivermectin. So that is the question. I have my next meeting coming up, so if you don't mind, I would like to take a quick break before that. There are lots of questions. So we'll continue this evening and we'll continue tomorrow. So please like, subscribe, and share. If you will not like to subscribe or share, then just like this video. YouTube's algorithm thinks it's a great thing if you like the video. And then in addition to that, if you would like to support this work, there are 3 links in the description. One is to buy me a coffee. If you don't want to use PayPal, Buy Me a Coffee does not use PayPal. And then there is a Patreon. And thank you very much. My Patreon account has reached $1,000 per month, which is excellent. So thank you very much to all the patrons. And then if you still wanted to support this work without using Buy Me a Coffee or Patreon, you can just use a PayPal link as well to support. Thank you very much, and I would see you this evening.